All right, we're gonna go live.
Yay!
Thank you for doing this on a Saturday, girl. Saturday morning. Appreciate you. all right. All right. Good morning, everyone. Happy Saturday. And Dr. O here. I'm so excited. I always say that I'm excited anyway about this live, but I'm particularly excited because our audience, our the people we're focusing today on our kids. So yay. I help people live long and well. And today we'll be talking about how to take care of kids in pain. I'm really excited to have our guest on today. Her name is Dr. Alicia Peterson. She is amazing. I'll let her introduce herself, but she's phenomenal. She's big on improving quality of life when it comes to pain. She's Harvard trained. She's the bomb. She's an award-winning Toastmaster speaker. And we're going to be having a good conversation today to learn how we can help our kids take care of themselves or take care of them when they're in pain. If you are watching live, you know what to do. Hashtag live. If you're watching a replay, hashtag replay. Dr. Alicia, can you kindly introduce yourself again, who you are and what you do?
Thank you, Dr. O, for inviting me on. I'm really excited to speak to your audience today and address any questions they may have. And we're going to have a great conversation regarding pain in children, how to treat, how to assess. As for me, so I am based out in Washington, D.C. I'm a board certified anesthesiologist, pediatric anesthesiologist, and pain medicine specialist. And board certified simply means that I received formal training and I underwent a series of examinations to ensure that my knowledge is up to date. I am also, regarding my pain training, I was trained through the Harvard system. And it was through that process that I realized the great need that we have in assessing and treating children's pain. We know that pain in children is under-recognized, and because of that, it's untreated very often. And so my journey really with wanting to work with children with chronic pain came from the fact that I always wanted to work with those patients that were the most vulnerable. See, within anesthesia, um, we take care of patients in that surgical period. And people come to the operating room so nervous, so scared, and being able to offer that kind of support, supporting them mentally and physically throughout their surgery, I found that in that process, you know, what really got me was patients when they woke up and if they had pain, that was a really vulnerable time. And in my mind, who is more vulnerable than a child in pain?
Wow.
So I wanted to extend my service to children in pain, not just in the surgical arena, but also longitudinally. I wanted to take care of them in their day-to-day life. And so that's what led me to want to care for children in pediatric pain in a clinic setting. Because I'm telling you now, to have patients come to me in a wheelchair and then at the end of a few months come to clinic in their soccer uniform, I mean, my God, like
Wow.
the
Wow.
transformation is real.
Wow.
So what we're talking about today works.
Awesome. I'm glad that you do what you do, especially in a population that's not very good at communicating their needs, so well. So being able to do what you do and I'm excited as to what we're going to talk about today. So this is good. Now my first question to you would be, how do we, are there different kinds of pain as far as adults versus children, like pain experiences? What would you say are common differences? Or is it all the same?
Right. Great question. Let's get into it. So when we talk about pain, the experience of pain between children and adults, that's not what's different. Let's first talk about what pain is, because I want to expand everyone's definition. Because when people think of pain, they think it's something that lives in the body. Oh, I bruised my knee. I broke my ankle. And pain is coming from the ankle or the skin knee. And that's why I have pain, right? Because I injured a part of my body. And the way we treat that pain is just rest and medications, allowing the body to heal, and then pain goes away. But here's something that many people don't consider. And that is that we know that pain is not connected to tissue damage. Pain, people expect, oh, well, of course, I'm going to cry if I break a bone or if I, burn myself, but that's not always the case. We know this because when we look at soldiers who've had limbs blown off and didn't even know it, they're running back on the field to drag their fellow combatants off the field. They didn't even know that they lost a limb. So if pain is connected to tissue damage, then these gentlemen would be writhing on the ground, howling in pain. So, what an important message I want the audience to know is that pain actually lives in the brain. And what happens is that stuff in life happens, right? Uh, maybe you tripped, right? You tripped somewhere. And what happens is that sensation of you falling, it goes through the brain and the spinal cord. And that sensation goes through a series of filters. One of those filters is, have I been in this situation before? Do I have a prior history of this? And if your prior history of being in the forest is fun, then you're going to trip, get yourself up, and keep moving. It's like no big deal. But if your prior history has been, well, this is where I got into that fight with this other kid, or this is where I got yelled at. Now that sensation is going to be, that sensation is going to cause some distress. For those who have pre-existing anxiety or depression, that sensation is going to be amplified through that filter. So a sensation coming from the leg or from the arm, it's not something that is pure, meaning that it doesn't, oh, okay, the degree to which I am hurting or the degree to which I have tissue damage here, that equates to how stressed I'm going to be. Not at all. It goes through a series of filters, and it is through these filters, these mental filters, that determines how much distress a person is in. So that is why we need to look at body and mind when it comes to addressing pain. Now, the pain that we all talk about and know is what we call acute pain. That's the pain caused by tissue damage. But what I want you to also keep in mind is that uh, there's another aspect of pain called chronic pain. Now, you would think that, oh, okay, well, we have acute pain and we have chronic pain. Isn't chronic pain just a prolongation of acute pain? Like, what's the difference? And the difference is this. I would like for you to think of pain as a fire alarm. Now, the fire alarm is supposed to alert us when there's a fire.
Right.
And we trust that when an alarm goes off, there's going to be smoke or something that requires us to leave the building. But we all have been in those situations where the fire alarm is just going off on its own. Maybe the battery is dying. Um,
Right.
Maybe it just decided to malfunction. And what do? When we hear that fire alarm go off, we know that we're fine. And if anything, we just need to address the alarm. Well, think of pain in a similar way. When and parents, everybody, no one wants to see their kid in distress. No one wants to see them in pain. Um, but a lot of parents, they don't realize that not all pain is caused by tissue damage. So when they see their child screaming and writhing and upset, they're like, oh my gosh, what is hurting them? What's going on? And they go, they get labs done, they get imaging done, and parents will tell me things like, well, they didn't find pain there. And I
Okay.
always have to correct families and say, those imagings and labs, that's not going to find pain.
Right.
What that looks for is tissue damage.
Definitely.
That's what it looks for. So when we talk about now going back to the fire alarm, we recognize that there are times where that fire alarm can malfunction.
Right.
And in chronic pain, those signals that are supposed to alert us when there's tissue damage, sometimes those wires can be crossed too, so that there's no damage in that child's body. They've received images, tests, everything. All things look normal and good. The problem is that people don't realize is that the signaling system itself can go haywire. And now we need a different means of treating that. We're not going to the emergency room, getting medicines, resting. Parents have found that that doesn't work. And it
Mm.
doesn't work because it's not addressing the alarm head on. It's addressing some kind of tissue damage, which we know doesn't exist because all their labs and imaging was normal. So I want to encourage families to recognize that pain exists in the brain and it is possible for the pain signaling system itself to go haywire. And when that happens, we need to look at a more holistic form of treatment. And so, what that looks like is we need to reboot the system. And the reboot for chronic pain looks like uh, physical therapy,
Mm.
because we have
Mhm.
to engage that part of the body that the child's neglected. Odds are if their foot is hurting and every time they move their foot, they have pain, they're not moving their foot.
Right.
And what happens is that those nerves that provide sensation to the foot, they're not getting stimulated. And if they're not receiving touch and movement like their other foot is receiving, then what that does is provide a negative feedback loop. And those nerves are going to just become more and more dysregulated. So which means that the system is just getting worse and worse. The good news, and here's where kids and adults are a little different. For kids, we have something called neuroplasticity on our side, which means that just because, let's say that child's foot has been hurting for years,
Mm.
once we plug them in the right treatment, active strategies to reboot the nervous system in that part of their foot, it doesn't take years and years for them to get better. Their
Mm.
nervous system can align into a normal picture quicker than adults. Adults have neuroplasticity too, it just acts slower. So, with kids, just because they've been in pain for years doesn't mean they'll always be that way. And if we plug them into the right treatment, they can get better from weeks to a few months. So, that is the really good news about this. Um, I want to express, though, when it comes to treating chronic pain, if we're going to reboot that system, which we have to do, it requires active treatments. So
Mm.
it's not like that tissue damage where you break a bone and you just kind of sit back, rest, take a few pain pills, and allow the body to heal. No. With chronic pain, because we have to change that signaling, we have to fix it, we need to employ active strategies, which means that in physical therapy, the child is actively doing, like moving that part of the body that they've neglected. They're touching that part of the body that they've
Mm.
neglected. And I always tell families that, initially pain may get a little worse before it gets better,
Yeah. Wow.
because we're engaging the nervous system in a way that it hasn't had in a while. But the good news is that it's not like that always. As the nerves become retrained, that pain gets less and less and less.
Wow. I like the hope you bring in understanding pain and that it's possible to have that adjusted or addressed and improve quality of life, and well, you're doing it from the inside out. So it's from the inside out. So I like that. So I have someone asking the question here. She's saying, how does fibromyalgia work in this case? This is an adult asking.
Ah,
How does that play? Maybe we can touch on that real quick, even though we're talking about kids today.
yes, yes, it's okay. So, fibromyalgia, this is it's a chronic pain condition, which, as I mentioned, as soon as we say a chronic pain condition, recognize that it's the signaling of the nerves that is haywire. Particularly in fibromyalgia, we know that the pain threshold is lowered, which
Mhm.
means that people with fibromyalgia are more sensitive to pain. So, you know, I may be able to hug someone that doesn't have fibromyalgia, but if I try to do that with someone who does, they're like, ow, 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 because their pain threshold is lower and they're more sensitive to pain. Now, what treatment looks like for them is it's again a chronic pain condition. So we need to treat the body, and the kinds of things that we would look at for fibromyalgia is doing low impact aerobic conditioning, things like aqua therapy,
Mhm.
swimming, cycling, things that'll get the heart rate up and help exercise positively restores the nervous system, which
Mhm.
is why physical therapy always comes into play when it comes to chronic pain. It's just that the physical therapy regimen is going to differ depending on what your condition is.
Mhm.
And so
Mhm.
for fibromyalgia, we really want to emphasize low impact, not putting a bunch of stress on the joints, and doing something regularly. Also, um, fibromyalgia, a lot of folks who have it also have anxieties and depressions, and they need, I mean, everybody with chronic pain needs that psychological support. Now, what many people don't realize is that within psychology are tools to actually address the chronic pain too.
Mhm.
I
Mhm.
mentioned how signals from the body goes through filters in the brain, and those filters can decrease pain or increase pain. Treating anxiety and depression relating to pain actually makes that filter so that it doesn't amplify the pain as much.
Mhm.
So, through psychology, learning coping strategies, relaxation strategies, um, actual modalities to um, make you do some scary stuff, because initially the treatment when it comes to chronic pain, it, like I said, it causes pain to increase a little bit more before it gets better, and people get scared because they're like, look, I don't think I could take much more of this, right? And so we need those psychological modalities, we need those elements in our toolkit so that patients feel strengthened and emboldened to be able to do this treatment. um, and we have to also redefine what success looks like. Because for
Mhm.
some people, they're
I
like,
like
"Look, I want to be pain free. I want to be pain free like last year." And it's like, wait a minute. Can we celebrate that 5 minutes you had today where you forgot that you had pain? Can we celebrate those 5 minutes and focus on elongating the success that you already had? Can we celebrate the fact that you were able to engage in, like, 15 minutes of that aerobic activity, that walking? You were able to do 15 minutes of walking when just last month you were only barely able to get out of bed, right? So, with using these tools, we are acknowledging that what progress looks like,
Mhm.
because people don't realize that you're actually getting better. But because they're so narrow focused on one outcome, they can't even celebrate their wins. So, that is the role of psychological therapy, and the role of physical therapy is to get us more functional. Now, the role of medications in chronic pain is a little different because, as we talk about opioids, opioid crisis, big pain, um, people popping this to address pain, but we have to look at that opioids really are intended for post-surgical pain, pain
Mhm.
relating to tissue damage. And then
Right.
as the body heals, your need for those medicines go away. For folks who have chronic pain, the medicines that we look at, if pain is so severe you're unable to participate in cognitive therapy and physical therapy, then we look at supporting you also with a medicine. And usually those medicines are something that works on the nervous system.
Mhm. Mhm.
So whether that be like um, an SNRI, which is a selective norepinephrine reuptake inhibitor, or looking at a neuropathic agent like a gabapentin or something like that. But it's a different class of medicine, not an opioid. And that is to help calm down that nervous system
Mm.
so that you are okay enough to initiate the restorative therapies that we know are going to um, decrease frequency of flares, decrease pain intensity. Um, so, yeah, when it
Awesome.
comes, yeah,
That was in depth. Thank you. Thank you. And she's giving you a thank you and a yes to that. Now, she said this is good, so great. How can caregivers effectively assess pain in kids who may not
yeah,
be able to express their discomfort verbally?
yes, because as I mentioned, pain in kids, unrecognized and untreated. Uh, there are four. So for parents, parents know their child. They know their child's baseline and they
Mm-hmm.
know when something is wrong. So really us as physicians and medical professionals, we need to assess, well, what is it that you're noticing? How was the child before and what is the changes that you're noticing now? When it comes to healthcare professionals assessing a child's pain, we have various pain assessment tools. So for those kids that are nonverbal or infants, we have something called the FLACC, FLACC. It stands for face, legs, activity, cry, and consolability. And it's a scale, it's a behavioral scale that's measured from 0 to 10.
Mm.
And anything that's above 6 is really moderate to severe. It suggests pain. Another pain assessment tool is called FACES, and it's the Wong-Baker scale that we look at. Because if you look online and put in FACES scale, you're going to see animals and colors and all kind of crazy things. But the tool that actually works is the Wong-Baker scale, and it's just a school age kid. You show them a series of faces and ask the child, how are you feeling right now? Point to
Mm.
the face. And they would point. And as I mentioned, anything pretty 6 and above is pretty moderate to severe. And then finally, the scale that we're all familiar with as adults and teenagers is the numeric rating scale, which we ask from 0 to 10, how severe is your pain? Like 0 is no pain, 10 is excruciating,
Mm.
and 5, I always say, is tolerable. So where do you lie with that? And we know it's an imperfect scale. It's an imperfect scale because it does not in any way um, give us as medical professionals any indication as to your quality of life. It doesn't include like, are you sleeping? Um, are you able to engage with family and friends? Are you
Mm.
able to go to school?
Mm.
Are you able to work? Are you anxious and depressed because of this pain? All it strictly talks about is pain intensity. And for those who have chronic
Mm.
pain and living with, probably an 8 out of 10 all the time, it's a very
Wow.
imperfect
Wow.
measure. We who treat people with chronic pain, we look at what is your quality of life? And your quality of life is tied to your function. And so function looks like, are you able to go to school, working, engaging with family and friends? Are you able to sleep? These are all measures of function. And this is what we look at to determine, are we moving in the right direction?
Wow. I like how you talk about the quality of life. And sometimes what I encourage patients to do or the advocates is to communicate how the quality of life is affected based on whatever is going on, the pain, to help communicate that, to help explain how, I guess, level of intensity too, right?
Yeah.
But quality of life is big. Thank you. That's really important. Now, are there none? I know you talked about, non-opioid options. I know we're not delving into the details because, of course, these are medical suggestions. We encourage patients to go see their doctor to talk about a personalized plan for them. But are there non-medication techniques that parents and caregivers can use to help relieve pain in their kids?
Yes. So when it comes, so one, I want to emphasize that when it comes to pain expression, right?
Mhm.
Um, really we want to identify, well, what is distressing the child?
Mm.
And so, for example, if it's acute pain and they just had surgery, then obviously we're going to do rest. We're going to do the appropriate pain medications, and no matter what kind of pain they have, distraction is our friend. What are the shows that they like? Do
I
they
love
enjoy
it.
coloring? If the child admitted into the hospital, I often ask for, can child life services come by and we can get pet therapy. We can get an animal to come that they can pet and engage with. We can get some more arts and crafts in here. But distraction really is our friend because, as I mentioned, pain is in the brain. And so, if the child's bored and just sitting there and all they can think about is really their pain,
Mm.
then the more you think about something, the worse it gets, right? Whatever you focus on is going to expand. And
Yes.
so we don't want the child sitting there just, and that speaks to why we want our kids, even if they have pain, to go to school because school is full of rich distraction. It keeps them on a schedule, gets them out of bed regularly. They're engaging with teachers and other students. And that's why we don't want them just sitting at home. So,
Hmm.
distraction really is key. And I would also encourage, I know we're still in a mental health crisis when it comes to many of our teens and adolescents, but getting that child on a wait list if we do find that, let's say, beforehand the child was depressed and anxious, and now they're also struggling with pain. We really want to, if they're not plugged in with a psychologist, we really want to work on plugging them in and getting them on the wait list sooner rather than later. Because when someone who already is combating anxiety and depression now gets this extra load
Mm.
when it comes to pain, that's the time when they really start to fall apart, and we don't want that.
Mm.
So, yeah, I would say overall, distraction is our friend. Really pulling out what it is, what your child likes. How can we do that in the state that they're in right now?
Mm.
And it might
Mm.
be modifying it, right? Like if the kid loves soccer, well, they're not in a position right now to play. But is there a way that you could do little finger soccer, or is there a way we can watch a game, or something where they're still connected to the activities that
Mm.
they love?
Mm.
It may just be in a modified way.
I love it. I love it. I love it. Even with blood draws, distractions work. I love the pet therapy too. I love the idea of that. Studies have shown that actually calms. So that's really good. So we're wrapping up. Time really went. I didn't get a chance to ask half of my questions, but that's okay. But I want us to end on a positive note. Are there any success stories where pain management significantly improved a child's quality of life that you'd like to share, just to encourage our
Oh,
viewers on what's possible?
absolutely. Oh
Mhm.
my gosh, absolutely. So there is a particular condition called complex regional pain syndrome,
Yeah.
also known as CRPS, where, as I mentioned, that signaling system has gone haywire to the point where the child can't even touch that part of the body that hurts. The wind can't blow on it,
Um,
shower, can't even hit it.
mhm.
They're just that sensitive. And families come to me in tears because they've already been to so many different specialists, and everybody has said, "We don't know what to do. We can't help you." And I want to emphasize that and acknowledge that a child in pain, that's the whole family in pain. That's
Mm.
not just one child. And because the child has been in distress for so long, the families are just like, is there really any hope? And the answer resoundingly is yes.
Mm.
Yes, there is hope. What is beautiful about the treatment for chronic pain is that it is highly tailored and personal. So if the person is like in a wheelchair and they're not able to do what we call land-based physical therapy, they're not able to stand up and do all these things because they've been in a wheelchair for a while, then what we do is we look at starting them in the water and letting
Mm.
that buoyancy of the water encourage their rehab. A lot of kids enjoy the pool. And so this is like, wow, this is something that it's like almost a treat. So what we so in these cases, when families come in distress, the child has a ton of pain, and diagnose them with complex regional pain syndrome. Uh, if the pain is so severe that they can't, again, do therapies, then I do prescribe a little bit of a medicine to help relax the nerves, and then initiate the treatment, which usually is once a week for 12 weeks. And we work with the families, the kids' school, so that
Mhm.
they have time off to be able to do these treatments, because often it's during the weekday, uh,
Right.
as well as them working with a cognitive therapist, because we know that, again, pain has interfered with every aspect of their life, and we need to help them get their life back again. So, and the treatment, usually therapy is also, once a week, and then they get homework to do. Um, Usually it's fun homework, like, oh, spend 5 minutes with a friend. Again, re-engaging in life, because so many people isolate themselves when they're hurting. Well, the beautiful part about this is that when kids, they don't get like a little bit better, they get 180 degrees better. Okay. Like I said, they came to me in a wheelchair, and by the end of the treatment, they're in their soccer uniform.
Wow.
They are, it's as if nothing has ever happened. And that's what I mean by we have neuroplasticity on our side. These kids get incredibly better when we plug them into appropriate treatment for their pain, which, again, these kids work for it, because they're not kicking back, taking a pill. That's not going to work. They are doing the work
Mm.
in engaging in therapy, doing range of motion, standing on their feet, doing scary things they haven't done in a while. And that is what reverses this process. So, yeah, it's rewarding. And I just want to encourage any
Awesome.
family who's dealing with this, like, your child can get better, like, and not just a little bit, but a whole lot. We just need to plug them into the right treatment.
I love it. I love
Yeah,
it. You just got to plug them to the right treatments. You got to advocate for their care, and you keep asking to get the resources they need. This has been awesome. We're past time, but I know people are eager to ask, Doc, where are you? How can we connect with you? How can we follow you? What can we do? Doc, where can people find you to connect with you? Either to have you come speak on their platform, to
yes.
listen to other content, very rich content that you do share. But Doc, where can people find you?
Absolutely. So, because by the time patients saw me, they were already out of school. Families, parents have like lost their job because they've had to go back and forth and get their kid from school and all of that. I really now am focusing on how can we prevent kids from how can we prevent kids and families from chronic pain just like racketing their life?
Mm.
So, a lot of my work now is that I work with pediatricians on how to identify and treat pain on the front end, so that
Mm.
families aren't having to wait months and years to see a pediatric pain specialist, because there's not that many of us and the wait lists are long. So, my website is aliciapetersonmd.com. And I do a lot of speaking and workshops on assessing and treating pain in children. Also, you can find me on LinkedIn at Alicia Peterson MD. And those are the primary ways to reach out.
Awesome, awesome. So I put the website at the bottom as
Mhm.
well. So very simple. Her name, md.com. Like it's right there for those of you who are watching live and those who are watching replay. Connect with her. A lot of useful information you could watch. And she's an author. So just so you know, multi-time
Oh,
author.
and also, just real briefly, for
Yes.
those parents who want to read more and learn more about chronic
Mhm.
pain, Lorimer Mosley is a researcher who's done a lot of great work in this region. And I would encourage families to look up Tame the Beast. There's a lot of research backed, informed techniques on how to address chronic pain. So,
Tame
Tame
the
the
Beast.
Beast. Yes.
Okay. Tame the Beast. I like that. Okay, so I put it also in the comment section for those who are wondering. But thank you so much for doing this. I appreciate you for taking the time on this Saturday morning to come and have a conversation with us on such a very important topic. I will have you back in a
Yeah.
few months so we could do a part two to this because this was very, very helpful. And maybe we can finish the rest of our questions this was good. Thank you so much, Doc. I appreciate
You're
you.
very welcome.
All right. And thank you all for watching live replay. As always, caring and sharing. You know someone who could use this encouragement in the form of this video. Forward it to them. It's free, costs you nothing, and they'll thank you for it. As always, subscribe, follow us, like us, tag us. I will tag people in the comments so they can watch this as well. And as always, if you're looking for someone, a good family physician who is thorough, who is patient, who is caring, and who will have conversations like this to help you live long and well, I am she. Thank you again. Have a good one, everyone. Thank you so much, Doc. I appreciate you.